how do we evaluate these patients? Well, the first and the most important investigation that needs to happen is an upper GI endoscopy. What it means is we pass a tube which goes down the mouth through the esophagus and into the stomach. This test is a good test to give an idea about the integrity of that valve mechanism. But more important than that, this upper GI endoscopy also gives us an idea about the inner lining of the foot pipe and the stomach. Just to explain it in a bit more detail, the lining of the foot pipe is quite different from the lining of the stomach. We call the lining of the foot pipe as a squamous lining, and the lining of the stomach columnar lining. The columnar lining is quite a strong lining. It's supposed to withstand the acid in the stomach, whereas the squamous lining is not that sort of a lining. So it can easily get damaged, eroded when acid comes up. So when we do an endoscope, we are able to see if there's any change to the lining in the lower part of the foot pipe. And if there are any specific changes, any worrying changes, we can even take biopsies to decide where next we have to proceed. Endoscopy is also good for giving us an idea about whether the patient has an associated hiatus hernia, which is another common condition. Reflux and hiatus hernia often coexist, but then not every patient with hiatus hernia needs to have reflux. But it's something that we would like to know in an upper GI endoscopy. Now, if the patient is going to have only medical treatment, an upper GI endoscopy is usually all that is required. However, if the patient goes on to have other forms of treatment, such as laparoscopic surgery, which we will talk about in a little while, they need to have other investigations as well. And these are specific investigations, and we call them as a 24-hour esophageal pH and an esophageal manometry. Basically what it means is a test which will give us an indication about the level of acid in the foot pipe, level of acid in the stomach, and also it gives us an indication about how well the foot pipe contracts to dispose of the excess acid that refluxes into it. It's a very thorough test. It gives us an objective assessment of how much reflux is happening on a 24-hour period, and that certainly helps us to decide further management.